Hi, I'm Dr. Kurt Woeller. Often in my practice, I will do, for individuals on the autism spectrum and patients as well with mental health disorders, a test called the Urinary Peptide test. Now, this is from Great Plains Laboratory. It's a urine test, so it's relatively easy for most people to get, even from obtaining it from small children. And what we're evaluating is we're evaluating peptides specifically to gluten found in wheat, and casein found in dairy. Now, these peptides are small chains of amino acids that are found in these different types of foods. And when they're elevated, it indicates that there is an increased absorption of these peptides from the digestive system, and these things have a negative effect on brain chemistry. We know in autism that elevated peptides can affect language, can affect eye contact, can affect behavior, can affect cognitive skills in general. Certainly in individuals with mental health disorders, we know it can affect brain chemistry as well as behavior, etc. So if you find something that's elevated, if you find that the gluten marker, what's called gliadomorphine, or the casomorphine reactive to casein is high, those things should absolutely be eliminated from the diet. Often I'll find one or both significantly elevated, and removing one or both of those substances has had profound effects on people's health, particularly with kids on the spectrum. As I mentioned before, improvements in cognitive abilities, improvement in attention and focusing, improvement in behavior. The important thing to recognize about peptides is that they have a drug-like effect. They have a morphine. That's why they're called casomorphine or gliadomorphine. They have an opiate effect on the brain. And when you remove those, it's basically like removing an adverse drug reaction. In some individuals, they have such an addiction to those foods, they almost have a drug withdrawal when you take those foods away. And so initially, they can become irritable and agitated as though their brain is not getting that morphine, that opiate drug that it once had. But the upside is on the other side of that. Sometimes within 3 to 4 days, there's tremendous cognitive gains. So think of the urinary peptide test for individuals with autism or other mental health disorders as well, as a primary tool to assess for elevations of these peptides. And I guarantee you will find a significant amount of your patients have elevations to either or both of the markers on that test. Thanks.